Next, I'd like to introduce Team Lively. We have Jackie Kwan and Hara Moon.
Hi, my name is Jackie Kwan. I am a co-founder of our company Lively and an Insight Health Fellow.
Hi, my name is Hara Moon, and I'm also a co-founder of Lively. Currently, I'm a student in Master in Information and Data Science at UC Berkeley. So, simple question. Do you remember the year 2013? For me, 2013 was the best year of my life. I got married with this lovely man standing over here. But 2013 was also the worst year of my life. Just a few months after our wedding, I discovered this weird lump on my right breast. At first, I didn't think too much about it, and I kept on telling myself that I was way too young for anything serious. Unfortunately, I did end up in the NYU Cancer Center, along with other women who are undergoing very serious treatment like chemo and mastectomy. How did I feel? I felt extremely scared and lost. There was my OBGYN, my surgeon, my pathologist, numerous lab tests and exams. But what was weird was every step by itself was very clear, but all together, I was still very lost. The problem was that I felt like a ping pong ball bounced from one doctor to another. The 15-minute appointment with my doctor was way too restricting for me. I needed to better connect with the doctor beyond the exam room. I needed to feel I'm understood. And this is the motivation behind Lively. We have been interviewing people for months, and what we found is that people value their relationship with their primary care physicians a lot. These are often 20-year-long relationships. But the problem is that there is a lack of communication that increases anxiety. The average appointment may be adequate for your common cold, but certainly not the case for major illnesses such as cancer, the worst part being bounced from one specialist to another. Lively is a free and secure platform that allows asynchronous texting between the patient and the doctor through the doctor's room and care room, patient and family and friends through the cheer room. In the doctor's room, Lively connects easily the patient with the doctor, and it's very easy to use. You don't need to be tech savvy. For example, adding your doctor is as simple as adding your coworker on LinkedIn. If I had these chat rooms, then I would have been able to ask questions without waiting for the next appointment. Also, Lively connects doctors together. Today, 60% of doctors rely on fax as their primary form of communication. 60%. Lively is trying to shift this old communication form to today's technology. And it will allow doctors to work together as if they belong in the same clinic, from sharing files safely to coordinated care in a timely manner. And also, Lively serves as a bridge between different care teams, so the nurses, doctors, other care staffs can coordinate care. And in the cheer room, this is where your family and friends can show you support, which is very needed. In our prototype, we have also added additional features such as scheduling appointments and also telling your doctor about your allergies, medication, blood pressure, and so on. Our prototype tested great with user. And you know why? This is because we have incorporated feedback from over 100 interviewees. Some people loved it so much they couldn't even let down their phone. Lively is not just a texting app. Lively is an engagement movement. The theme of today's conference is changing culture. We want to change the culture in which the patient and doctor communicate with each other. And now the question, in case you're curious as to how my story ended, after the surgery, the doctor was able to confirm my lump was benign. But even for someone as lucky as me, it was a very emotional and exhausting journey. Lively would have made me feel less like a ping pong ball. And this is really what I sincerely wish to share with you. Thank you.
Are there any other competitive products out there that do similar or the same kind of thing?
Yes, there is. And the biggest difference between Lively and some of the other service offerings is our business model. In terms of how other apps and services make money, they usually make money from either the employer, from the physician, or from a small fee. We certainly have people who are willing to pay for our service in our interviews with with patients. They are willing to pay something like 99 cents to like a nominal fee, like what you pay for Netflix, $7 to $8. But our intention is to make this as a free service. So if you can see the different services that we provide, from the doctor's room, cheer room, and also here from fundraising to calendar, these are all services that are being provided by external parties. And the intention is not for us to reinvent the wheel, but to create an open platform where external vendors can provide these services, sharing files. I'm sure every one of us can think of a few services that can provide those services, and we, for a nominal fee, we will put their application on our app and allow users to create value there.
Assuming that like the doctors are only going to respond during their work hours, how is this different than just emailing them?
So yeah, I'm glad you asked. So previously, I think someone asked, how is this different? How are different services different from the existing patient portals? Most hospitals have patient portal services, and the regulation right now is the meaningful use requirement is that if a service meets a 5% adoption rate, then CMS, the government, will reimburse the hospitals for that service. But the thing is, even 5% is a very difficult mark for most hospitals to adopt. And the difference here is that this is a mobile platform, and as we've seen in the recent years, I believe it was 2014, the web traffic from mobile services had already eclipsed what we see from desktops and PCs, and that's the major difference between what we're offering.
And maybe just one more thing, if you want to differentiate from email to texting, and this is what we have learned from our interviews with the users, is they were saying they prefer much texting over email. Email, it takes more time. Dear doctor, you have to start with a nice introduction at the end. But then texting is very straightforward and it's less intimidating. So I think anybody can use texting, and I'm sure that here in the room most people have already used texting, which is something so familiar with people. And we want this to be very friendly for patients and something very easy to use, no matter what age, no matter what profile you have.
I really appreciate your attention to all your interviews to patients. That's great. And one of your key features, it seems like, is the interaction with physicians. So did you do interviews with physicians as well, and how did they respond to this?
Yes, we did. We had many interviews with physicians first. And of course, the first barrier we had was, oh, this will be extra work for them, right? Texting, because they already, and we understand that doctors have a lot, like not just responding to calls or emails, but all those filings, all those administrative work and all that. So I guess our challenge was, how can this texting help them actually to have less work, right? And through interviews there were a couple of points that we could have helped them, well, we were hoping to help. And one of the things was, for example, sharing files, and also the fact that it is an asynchronous communication, right? So if, for example, the doctor, the primary care physicians need to talk to a specialist, and if they're on the phone, sometimes they will be on hold for 20, 30 minutes. Whereas a text, it's something that you can just send a message, and during that waiting time doesn't look that long, being on hold on the phone for 20 minutes versus waiting for a text message to get back a text message 20 minutes, there's a whole difference. And maybe you can...
Yeah, and Casey, if you can pull back our previous slide, the last slide in our deck. We have a Twitter handle and a Facebook page, Yes to Lively. That is actually an open invitation to anyone, patients or physicians, who, if you want to be part of this change, please feel free to contact us or come speak with us after the session, and we'd be more than happy to include you in our design interviews.
Any questions from,
Sorry, I had
Joanna?
one more question.
Sure.
In the cheer room area, how do people become part of a community? Does it troll through your address book to find people you already know, or does it connect you to other people with similar problems that are outside of your immediate reach?
So the doctor's room is more like you bring your spouse or your family into the physician's exam room. The cheer room, on the other hand, is more up to you, as opposed to sharing live updates on Facebook or other social media where you have no control who of your friends will be seeing different statuses. That's up to you as to who you want to invite. Say if you, in our example, we have you invite your cousin, have one cheer room that you want to share a specific status, maybe not everything, but certain updates, like things are getting better now, or your coworker, which would be a reduced number of.
Any questions from the audience?
I just
Just
want
one
to,
more.
yeah, just one moment, please. So I just want to repeat your question is, how is it going to connect with your friends and family or people with similar disease as you? I would say similar disease as you, this will be a different room that we call the forum, where you could connect with people who's using Lively and went through a similar disease. And that will be, I guess, active once we'll have enough users to be able to group them together. But the cheer room, the idea of cheer room is really with your friends and families. And I have been seeing a lot of these nowadays in Facebook, where I know personally somebody's husband who had cancer as well. And it was like a community. He was inviting people, the wife was inviting people to cheer him up. And it really helped him. He was able to go through many chemo, and he was going through the last chemo, and send a message to everybody how thankful he was. So we can see that this could be, and I'm just imagining, I want to share this with only people I want and people that, I'm able to filter, not everybody on Facebook that, somebody that I just met once in my life.
Thank you.
Thank you.